sharply across Canada, affecting more children and adults every year, and anyone, regardless of age, lifestyle, or family history, can develop it. It's a serious condition that demands awareness, early detection, and management to improve people's lives. Joining us with more is Alessandro Sorrentino, Global Medical Head for Autoimmune Type 1 Diabetes, Sanofi, to help us understand more. Good morning and welcome to the show.
Good morning.
This is an important discussion. I have family members with diabetes, but it's really important to understand this specific type. So can you tell us more about type 1 diabetes?
Yeah, thank you so much for having me here. So type 1 diabetes, it's an autoimmune condition. What does that mean? That, we all have an immune system in our body, and unfortunately, at times, this immune system attacks parts of our body. In the type 1 diabetes, the immune system attacks specific cells in our pancreas that are called beta cells, and those cells produce insulin. So unfortunately, where the number of beta cells decrease, the body is not anymore capable to produce enough insulin. And insulin is a very important molecule in our body because it does regulate the level of glucose. And of course, not having a very well regulated level of glucose, then can have very serious consequences for the life of people that live with this condition.
Absolutely. Yeah, and there's some misconception about who can develop type 1 diabetes. And does it have to do with age? Does it have to do with lifestyle? Maybe you can clarify that.
Yeah, absolutely. So type 1 diabetes can occur to anyone, and it is not lifestyle related. Like many other autoimmune conditions, it's a mix of genetic factors and environmental factors. So it's really not about, your lifestyle. Unfortunately, these are things that can happen. And this is a disease can happen that, unfortunately, to everyone. So, this really doesn't depend on, as we said before, on your lifestyle.
Wow. So how many people are affected? I was a little bit shocked to see the number to begin with. And why are incidents of this disease growing?
Yeah, at the moment, the estimation is that 9.2 million people in the world live with type 1 diabetes, of which we estimate again that around 300,000 are in Canada. Interesting, as you said, there is also a misconception that this is a disease of kids, while 89% of people living with type 1 diabetes at the moment are adults. In Canada, we see an increase of this condition around 4.4% per year, and this is 4 times higher than the increase of the population. Unfortunately, this is a trend that is common to almost any other autoimmune condition. We don't really know the reasons why this is happening, but it is happening.
Wow. My understanding is there's no cure. Correct me if I'm wrong, but it's more about management to have a really, healthy and normal life as possible. But, are we anywhere close to a cure, or is that pretty much where we're at?
Absolutely. So at the moment, there is not a cure for diabetes. There is a lot of research in this direction. So what we know is that it is possible to identify patients earlier, and I think this is extremely important because when you identify patients earlier with early detection, then you can also decrease the burden on the patient, but you can also avoid serious complications. And especially, as I was telling you before, everyone can develop type 1 diabetes. But for example, if you have a first-degree relative with type 1 diabetes or a second-degree relative, or if you have other conditions, then the probability of you getting type 1 diabetes is higher.
Wow. Well, so, everyone should pay attention. How do we find out more information on this type 1 diabetes?
Yeah, one very important resource is uncoverT1D.ca.
Perfect. Okay, thank you very much. Alessandro Sorrentino, Global Medical Head for Autoimmune Type 1 Diabetes at Sanofi. I appreciate you being here today to have this very important conversation.
Really appreciate that. Have a good day.
You too. We'll be back with more on CP24 Breakfast right after this.